Welcome to another one. In this lecture, I'm going to present the client-centered frame of reference and how we use it in occupational therapy. I'm also going to touch on the principles underpinning the use of this frame of reference, its merits, the limitations. I'll also touch on the 7 key elements that we need to consider if we're using the client-centered frame of reference. I'll also touch a little bit on the assessments and interventions that are commonly used together with this frame of reference. So the client-centered frame of reference is based on Carl Rogers' theories of client-centered practice. Carl Rogers being a psychologist, so we're drawing our knowledge of the client-centered frame of reference from psychology. The client-centered frame of reference, it aligns very well with our philosophy in OT, as occupational therapy is actually defined as a client-centered profession. This frame of reference places the client at the center of the intervention. So everything that we are doing is based on the client's needs, and the goals, client's goals direct how the OT process is delivered. Core values of respect, partnership, and enablement are generally followed when we are using the client-centered frame of reference. The professional and clinical reasoning, as well as practice delivery, should reflect the client's needs if we're using the client-centered frame of reference. Looking at what this frame of reference focuses on, the first one is respecting clients' opinions, choices, and values. So it requires the therapist to actively listen to the client and also to demonstrate empathy. Personal responsibility for decision making actually lies with the client, but as the therapist, what we're supposed to do is enable the client to make those choices. Of course, we need to consider other factors like safety. For example, if you look at a client who might be having limitations and then they are not aware of the risks that they have, so it's also important to consider safety in as much as we are giving the clients the responsibility to make the overall decisions based on the choices that we provide to them. Provision of information and communication should be in a manner that the client can understand. So it depends on the client's abilities of understanding information or their preferred way of communication. That's the format that needs to be used when communicating with the client, so that the client gets information in a way that is adjusted to their level of understanding the information. Participation in individualized service delivery is also a key focus. There is joint goal setting between the therapist and the client, and the outcome measures that are used when we're using the client-centered frame of reference, they need to be outcome measures that are individualized based on the client's specific occupational performance issues. For example, the COPAM. Participation in individualized service delivery. I've touched on that one. Personal enablement, that's the other one. That's the other focus. So this is looking at listening and enabling the client to explore, as well as achieve and maintain their goals. This frame of reference has got a major focus on the PEO relationship, the relationship between the person, the environment, and the occupation. You might remember on our conceptual models, there are a number of conceptual models that we can use the client-centered frame of reference together with. But just to single out one that is heavily linked to this frame of reference, it is the CMOP-E, Canadian model of occupational performance and engagement. So it's also a model that is based on client-centered practice, and it works very well with this frame of reference. Moving on to the 7 elements of the client-centered frame of reference. The first one is the individual. It is important for the therapist to be very clear on who the client is. So when we're using this frame of reference, sometimes the client is an individual, it can be a group of people, it can be a family, it can be a community, it can be a population. So it's important when using this frame of reference to be very clear on who the client is. And all the interventions really, they need to be based on the needs of the specific client. The interventions or assessments that are implemented when we're using this frame of reference, they need to be done with the full knowledge and cooperation of the client. The second one is partnership. Considering that we're using a client-centered frame of reference, there is need for working together to achieve the goals. And usually, when using this frame of reference, the goals are actually jointly set between the therapist and the client. Goals should be focused on what the client wants to achieve. So it's not goals based on what the therapist is intending to achieve, but what the client wants to achieve. The third one is respecting and listening. The therapist should value the views of the client, and the therapist should adopt an approach that is welcoming, non-threatening, non-judgmental, non-authoritarian, so that the client feels comfortable to actually express their views. Because if the therapist doesn't create such an environment, then it's most likely that the client will not be able to freely share their views, and that will then hinder success of the use of the client-centered frame of reference. It's also important for the therapist to demonstrate empathy. So the therapist, when using the client-centered frame of reference, will mainly be using the empathizing mode if we look at those therapeutic modes. So the empathizing mode goes very well with the client-centered frame of reference. The fourth one is about empowerment. So there's always an imbalance of power when clients come to occupational therapy services. So the therapist has to intentionally shift power so that the client is viewed as a partner in this therapeutic relationship, as an equal partner in this therapeutic relationship, so that the client can then freely express their views, being given the power by the therapist. The fifth one is goal negotiation. It requires communicating effectively with clients to define, to clarify, and work towards the achievement of the agreed goals. So the goals need to be agreed, and working towards those goals is actually a joint process. The sixth one is language. Looking at what and how things are said. This is very, very important when we're using the client-centered frame of reference. So the way in which words are said, so this includes not only the verbal, but also the non-verbal communication that the therapist uses with the client. It is important that information be provided in a very simplified way, in a clear way, so that the client is able to understand according to their level of understanding. Sometimes there could be differences in language between the therapist and the client, and there might be need for a translator. But if you're going to be using a purely client-centered approach, there are some pros and cons that need to be considered when it comes to translating, because a purely client-centered approach will consider that the use of a translator might actually hinder communication between the therapist and the client. But however, the presence of a translator can also enable information to be conveyed between the therapist and the client if they are speaking different languages. The seventh one is informed decision making. So this one is focusing on honest and factual explanations about the risks and safety, so that this helps the client to make appropriate and informed decisions about their care. So there's need for clear verbal explanations in terms of the risks that could be involved with the different treatment options or intervention options that are available to the client, so that when the client is making a choice, they are fully aware of the risk that can be associated with the decisions that they'll be making. Also important, to ensure that what is being communicated is easily understandable. Sometimes it might be worth it to have it in written format, or it might be worth it to signpost the client to a resource where the information is presented in a format that is accessible to them, so that then when they are making decisions, they can then make informed decisions. The merits of the client-centered frame of reference: it creates an opportunity for increased client motivation and engagement in therapy, unlike other frames of reference where the client might be able to play a passive role. For example, if we're using the biomechanical frame of reference, there's a chance that the client might assume a passive role. But with the client-centered frame of reference, the client's engagement is really important. The other merit is that there are opportunities for improved treatment outcomes aligned with the client's defined goals. So goals have been developed jointly with the client, and the outcomes are most likely to be aligned with the client's goals. The use of the client-centered frame of reference can also allow enhanced client satisfaction as well as a sense of autonomy, because then the power is distributed to the client and they're able to make decisions or make a determination in terms of the direction in which their therapy goes. And then the other one is that the client-centered frame of reference enables a stronger therapeutic relationship to be built, because it's based on trust and also based on collaboration between the therapist and the client. So this frame of reference also has its limitations. Some of the limitations that have been identified include the fact that this frame of reference emphasizes on clients' autonomy, can leave some clients feeling lost or unsure of the next steps. And also addressing power imbalances between therapist and client, especially within institutional settings, can be very difficult, because institutions have already have their guidelines or protocols in terms of how the services are delivered, and that might actually hinder the distribution of power between the client and the therapist. Another limitation is the unconscious biases or personal views can unintentionally influence the therapist's responses and limit the person's exploration of the different possibilities. So when using the client-centered frame of reference, if the therapist has their own bias about the client or prejudice about the client, or if they are practicing in a discriminatory manner, then there is no point of achieving results as according to the client-centered frame of reference. So that can be a limitation, because it depends on the therapist's cultural humility, really. Clients with cognitive limitations might struggle to understand the therapy process as well as to set realistic goals, and this can actually make informed decisions very, very difficult if we are to use a client-centered frame of reference with clients who have got cognitive impairment. Particularly if the cognitive impairments are significant, then the effectiveness of using a purely client-centered frame of reference may be decreased. Looking at the assessments that are commonly used with the client-centered frame of reference, it includes assessments such as semi-structured interviews, where the client expresses their views, expresses their values, so that the therapist is actually aware of the client's values. The COPAM can also be used as an individualized outcome measure. MOHOST can also be used, but then if we're going to be using MOHOST with the client-centered frame of reference, we need to remember that the approach to use MOHOST when we're using the client-centered frame of reference, it should be that option for actually interacting with the client with the client's full knowledge that you are running this assessment. Because as we know, more can be administered with or without the client's knowledge. So if you're using a client-centered frame of reference, it will be important to make sure that your client is actually aware that you're administering an assessment. The occupational performance history interview, that one can be done. Any other client specific functional scale, that's one type of a scale, but similar scales can also be used. Role checklists, interest checklists, these are actually helpful in helping the therapist to get an understanding of what the interests of the client are, what roles does the client value, and then that can make the process of goal setting easy, collaborative joint setting easier. The occupational self-assessment, the more based assessment as well, can also administer assessments or conduct assessments of the environment. The interventions that can be used when we are using the client-centered frame of reference, these include approaches like client education, empowering the client with information, environmental adaptations or modifications. It might be assistive technology, depending on the needs of the client. It might be advocacy on behalf, not usually on behalf of the client, but actually in collaboration with the client. Self-management training so that the client is able to manage their meaningful occupations despite the condition that they might be having. Skills training, as well as interventions that are focused on enabling occupational engagement. And of course, many more other interventions could also be used together with the client-centered frame of reference. Okay, these are the references that I've used, and thank you very much.